My name is Nicole Lewinski. The following presentation showcases my preliminary capstone project presentation titled Breast Cancer Equity Dashboard, a Population Health Informatics Solution for Wayne County, Michigan. Let's begin. Breast cancer disparities extend far beyond the clinical diagnosis itself. As an oncology nurse, I have seen firsthand that delays in care are often not caused by disease complexity alone, but by barriers happening outside the healthcare setting. I have cared for patients who postponed imaging because they were waiting for insurance approval, and others who missed important appointments simply because reliable transportation was not available. These challenges may seem non-clinical on the surface, but they can truly affect whether a patient received timely breast cancer screening, diagnostic testing, or treatment. What stood out to me throughout my nursing experience is that these barriers are often not immediately visible in traditional clinical reporting, yet they can have a major impact on outcomes. This raises an important question for healthcare organizations. How can we identify these barriers earlier before breast cancer care delays begin to affect patient outcomes? To better understand the magnitude of this issue, it is important to consider the broader population health burden of breast cancer in the United States. Breast cancer remains one of the most commonly diagnosed cancers among adult women, with more than 320,000 new invasive cases expected annually, and approximately 1 in 8 women projected to receive a diagnosis during their lifetime. Although mortality rates have declined by 44% since 1989, largely due to improvements in screening, early detection, and treatment, these advances have not been experienced equally across all populations. This is especially important to my project because declining overall mortality can sometimes mask persistent disparities which affect vulnerable communities. In other words, overall progress does not necessarily mean equitable progress. Important healthcare reality is that organizations are not lacking data. In many cases, they are actually overwhelmed by it. The real challenge is determining which data matters, how to correlate it, and how to use it in support of informed decisions. Clinical data, cancer registry data, and social determinants of health information may all exist, but when these data sources remain disconnected, disparity trends and patterns can be difficult to recognize. Healthcare informatics can help bridge this gap by connecting data across systems and transforming raw information into actionable decision support. Instead of relying solely on retrospective reports, organizations can use informatics tools to identify high-risk populations, monitor delays in care, and support earlier intervention. The purpose of this Capstone project is to examine how healthcare informatics tools can identify and visualize breast cancer care disparities related to social determinants of health to support earlier recognition of hidden access barriers and treatment delays. My PICO framework helps to define the scope of this proposed intervention. The population focuses on adult women diagnosed with breast cancer in Wayne County, Michigan. The proposed intervention is an interactive oncology dashboard that incorporates social determinants of health and social vulnerability index indicators compared with standard reporting methods. The desired outcome is earlier identification of access barriers and treatment delays during a proposed 6-month implementation and evaluation period. Wayne County, Michigan was intentionally selected as the geographic focus of this project because it reflects a substantial breast cancer burden and elevated social vulnerability. This population carries personal significance to me as I have resided in Wayne County my entire life and I have witnessed the impact of social and healthcare inequities on family, friends, and community members. Compared with national benchmarks, Wayne County demonstrates higher cancer mortality along with greater socioeconomic challenges, including higher rates of poverty, food insecurity, and healthcare access barriers. Wayne County represents the intersection of elevated disease burden and significant social vulnerability, making it an ideal setting for this proposed dashboard intervention. Earlier identification of high-risk populations may support more targeted resource allocation and equitable care delivery. conducted a focused literature review using PubMed and public health datasets, emphasizing recent peer-reviewed studies examining breast cancer disparities, social determinants of health, treatment delays, and cancer outcomes. Across all 5 studies, higher social vulnerability and greater social determinants of health burden were repeatedly associated with later stage diagnoses, treatment delays, and poorer survival outcomes. Several studies also demonstrated that delays in care significantly worsened outcomes across the cancer care continuum. A major strength across the literature was the use of large cohort and population-based datasets, which strengthened the overall relevance of the findings. Common limitations included limited generalizability and the potential for unmeasured confounding factors. Overall, the literature provided strong evidence supporting the need for data-driven tools that can identify vulnerable populations earlier and support more targeted intervention. 3 major themes emerged from the literature review. First, higher social vulnerability was consistently associated with later stage diagnoses, treatment delays, and poorer survival with breast cancer. Second, access barriers such as financial hardship, insurance limitations, and transportation challenges often intensified these inequities. Third, evidence suggests earlier identification of these barriers may improve equity by supporting intervention before delays worsen outcomes. A critical gap in the literature is that while disparities are well documented, few studies translate those findings into real-time decision support tools. This gap directly supports the need for the proposed dashboard solution. Disparities in breast cancer outcomes remain constant, but an important gap holds key to translating those findings into real-time clinical action. The proposed dashboard integrates clinical, demographic, and social determinants data into a single real-time decision support tool. Workflow begins with data inputs from electronic health records, cancer registries, and social vulnerability indicators, and other sources. Data is then analyzed to stratify those most at risk for delayed breast cancer care. High-risk patterns signal the dashboard to generate actionable alerts to help oncology care teams intervene earlier with patient navigation, outreach, transportation assistance, or earlier care coordination. Ultimately, the goal is not only better visualization of disparities, but early action that reduces delays, improves treatment adherence, and supports more equitable breast cancer outcomes. To evaluate the effectiveness of my proposed Capstone dashboard intervention, several key performance indicators were identified to measure both process improvement and patient outcomes. These KPIs include screening completion rates, time to diagnosis, treatment initiation and completion rates, stage at diagnosis, and survival outcomes across demographic subgroups. Collectively, these metrics help us understand whether disparities are being identified earlier and if targeted interventions are improving access to timely care. The expected outcomes of this project include earlier identification of access barriers, reduced delays across the cancer care continuum, improved treatment adherence, and more equitable breast cancer outcomes for vulnerable populations. This capstone project demonstrates how healthcare informatics can help transform data into earlier action, better decision making, and more equitable care for vulnerable communities.